Before we dive in, don't forget to subscribe for more science-based health tips and natural remedies from a pharmacist's perspective. Did you know that more than 400 million people worldwide are living with diabetes? And this number is growing every year. That's about 1 in 10 people. It's so widespread that you probably know someone who has it, or maybe you've been affected yourself. Diabetes isn't just about sugar, it's a serious condition that can affect your heart, eyes, kidneys, and more. But the good news is, with the right knowledge, lifestyle, and even natural remedies, it can be managed effectively. I'll also be sharing an incredible plant backed by research that can truly help manage diabetes. More on that coming up. Diabetes mellitus is a chronic condition caused either by a genetic or acquired deficiency in insulin production by the pancreas, or by the fact that the insulin is not sufficiently effective. This deficiency causes an increase in blood sugar levels, glucose concentration in the blood, which in turn leads to damage affecting multiple organs or systems, particularly the blood vessels and nerves. There are two main types of diabetes, type 1 and type 2. Each of these affects the body in different ways and requires different approaches for management. Type 1 diabetes is an autoimmune condition where the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. This means the body can't produce insulin on its own, and people with type 1 diabetes must take insulin daily to regulate their blood sugar levels. This type of diabetes is often diagnosed in children, teens, or young adults, though it can develop at any age. It's less common than type 2 diabetes but is just as serious. Type 2 diabetes is the most common form, where the body either becomes resistant to insulin or doesn't produce enough to keep blood sugar levels in check. It's often linked to lifestyle factors like poor diet, lack of exercise, and being overweight, though genetics can also play a role. Type 2 typically develops over time, and is more common in adults, but it's also becoming more prevalent in younger people due to rising obesity rates. Unlike type 1, many people with type 2 can manage the condition with lifestyle changes and medications, though insulin may be needed in some cases. Gestational diabetes occurs during pregnancy and affects about 2 to 10% of pregnant women. It happens when the body cannot produce enough insulin to meet the increased needs during pregnancy, leading to high blood sugar levels. Though it usually goes away after childbirth, women who experience gestational diabetes are at a higher risk of developing type 2 diabetes later in life. It also increases the risk of complications for both the mother and the baby during pregnancy and delivery. Before we move on, it's important to mention two key concepts: prediabetes and insulin resistance. Prediabetes is a condition where blood sugar levels are higher than normal, but not high enough to be considered diabetes. It's like a warning sign: if nothing is done, it can turn into type 2 diabetes. Insulin resistance is often what causes prediabetes. It means the body's cells don't respond properly to insulin, so the pancreas has to produce even more to keep blood sugar levels under control. Over time, this can wear out the pancreas and lead to diabetes. The good news? Both prediabetes and insulin resistance can often be reversed with lifestyle changes like healthy eating, regular physical activity, and of course, the powerful plant I'll be sharing with you later, which has shown truly promising results. When it comes to diabetes, there's no single cause. It's usually a combination of genetic and environmental factors. If you have a family history of diabetes, especially type 2, your risk is higher. Certain genes can make your body more resistant to insulin or affect how your pancreas works. A diet high in sugar and unhealthy fats, being overweight, and not getting enough exercise can all increase your risk, especially for type 2 diabetes. Lack of physical activity means your body doesn't use insulin efficiently, and over time, this leads to what we call insulin resistance, when your cells stop responding properly to insulin. In some cases, the pancreas doesn't produce enough insulin, or the insulin it does make doesn't work as it should. This is common in type 1 diabetes, where the immune system actually attacks the insulin-producing cells. So how do you know if you might have diabetes? There are a few common signs to look out for. Frequent urination. High blood sugar makes your kidneys work harder to filter and get rid of the excess glucose. This leads to needing to pee more often, especially at night. Excessive thirst. Because you're losing so much fluid, your body gets dehydrated, and you feel constantly thirsty, no matter how much you drink. Fatigue. Your body can't use glucose properly for energy, so you might feel tired, weak, or even sleepy throughout the day. Slow healing. High blood sugar affects blood flow and weakens the immune system, which means even small cuts or infections take longer to heal. But it doesn't stop there. Heartbreak over time. Prolonged high blood sugar can damage important organs, like your heart, kidneys, eyes, and nerves. This is why uncontrolled diabetes can lead to serious complications. One of the most common is neuropathy, nerve damage that often causes tingling, pain, or even loss of feeling, especially in the feet. Then there's retinopathy, which affects the eyes and can lead to vision loss or even blindness. Kidney failure is another major risk, as high blood sugar can damage the kidney's filtering system. And let's not forget the heart. Cardiovascular disease is a leading cause of death in diabetics. That's why early diagnosis and consistent management are so important. The most prescribed medication is metformin. It works by reducing the amount of sugar produced by the liver and improving how your body responds to insulin. In cases where blood sugar can't be controlled with metformin alone, doctors may prescribe insulin injections or other medications like sulfonylureas, SGLT2 inhibitors, or GLP-1 receptor agonists. So, here's the thing. Managing diabetes doesn't always have to mean strict diets, intense workouts, or relying solely on medications. There's actually a natural plant that has shown remarkable potential in helping regulate blood sugar levels. And the best part? You don't need to break a sweat to get the benefits. In fact, this plant could even help prevent diabetes in the first place, without the need for exercise. Sounds pretty amazing, right? The plant I'm talking about is olive leaf. Yes, those olive leaves that we often overlook are actually packed with powerful compounds that can help lower blood sugar, improve insulin sensitivity, and even prevent diabetes. Studies have shown that olive leaf extract can work without the need for intense exercise, making it a great natural option for anyone looking to manage their diabetes in a more holistic way. You can consume it as a supplement or even brew it into a tea. Just a simple addition to your daily routine could make a big difference. Olive leaf extract is packed with powerful compounds that work together to improve blood sugar regulation. The key compounds responsible for these benefits are oleuropein, hydroxytyrosol, and other polyphenols. Let's break down how these work and why they're so effective. Oleuropein, the star compound. Oleuropein is the primary active compound in olive leaves, and it has powerful anti-diabetic properties. It works by improving insulin sensitivity. Oleuropein helps your body's cells respond more effectively to insulin. When your cells become more insulin sensitive, they absorb glucose from the blood more efficiently, keeping blood sugar levels stable. Reducing glucose production in the liver. Oleuropein also reduces the amount of glucose produced by the liver. The liver plays a major role in blood sugar regulation, and by reducing excess glucose production, olive leaf extract helps prevent dangerous spikes in blood sugar. Enhancing insulin secretion. Oleuropein boosts insulin secretion from the pancreas, which helps lower blood sugar by enabling the body to process glucose more effectively. Hydroxytyrosol, the antioxidant powerhouse. Another crucial component of olive leaf is hydroxytyrosol, a powerful antioxidant. Hydroxytyrosol works in several ways, protecting beta cells. It protects the beta cells in your pancreas, which are responsible for producing insulin. These cells can become damaged over time due to oxidative stress, especially in people with diabetes type 1. By reducing oxidative damage, hydroxytyrosol helps preserve the pancreas's ability to produce insulin, which is vital for regulating blood sugar. Fighting inflammation. Chronic inflammation is a major contributor to insulin resistance. Hydroxytyrosol helps reduce inflammation throughout the body, which can improve insulin function and prevent further damage to insulin-producing cells. Olive leaves are rich in polyphenols, a group of plant compounds known for their ability to combat oxidative stress. By neutralizing free radicals, polyphenols protect cells from damage and improve insulin sensitivity. Polyphenols also help improve blood circulation, which is important for overall health. If you want more natural tips from a pharmacist, health problems explained, and advice on managing your wellness naturally, follow me for weekly health videos. Don't forget to like, share, and subscribe to stay informed. Got any questions or personal experiences with managing blood sugar or other health concerns? Leave them in the comments. I'd love to hear from you. Stay healthy, stay informed, and take charge of your health today.